From WNYT Albany, News Channel 13, Weekend Today.
Tinnitus is the constant sensation of ringing in one or both ears, even when there is no sound present. While there is no cure, several options exist to treat the ringing. Here to talk more about tinnitus treatment through therapy is Dr. Christine Raffo, an audiologist. Good morning to you.
Good morning. Thank you for having me here.
Absolutely. Thank you for coming. This is very important. Some people hearing this thing and they think that it's their ear, so absolutely it might not be their ear, their hearing. It's probably the brain.
Well, that is the current theory, that it is phantom hearing for people who are starting to lose their hearing. The brain is filling in the void, and it fills that in with a sound that is audible, especially when it's quiet. You're in a quiet environment.
You see a lot of people coming into your office with that kind of problem?
Tinnitus affects 50 million Americans, so it is a very common thing to happen for people. What really becomes the issue is how well they can handle that constant ringing, and for a lot of people, that's very stressful.
For some, it's more than others, right? So for some,
yes.
It's light, some it's...
They've actually done studies to try to figure out what was it that made it so distressful for some people, and found that it really wasn't how loud the ears were ringing, it wasn't the pitch that was making it, that it was ringing at, that it was more just how the person could deal with that constant ringing to try to get away from it.
And that obviously affects your life. I mean, if you constantly hear this thing in your ear, it just doesn't work for you sometimes when you're trying to do something else.
That is correct. That is correct. For some people, they're very absorbed by that ringing. It is really all that they can sort of focus on.
Exactly.
Which is why now the treatments that are going on are an attempt to sort of keep your brain busy to fill in that void of hearing.
All right, let's talk about the treatments then.
Okay.
How do you fix that? I mean, if it's your brain, it's something that's probably therapeutic that you have to do.
Well, the first situation is to get a hearing test and find out what parts of the hearing are missing or not up to normal, and then to look at amplification to help with that, hearing aids to bring in those sounds in your environment. But ringing really bothers people when they're in a quiet environment. It's much more noticeable there. So they have produced instruments now that will put out a digitally fractal tone in sort of a chime-like quality. It's presented at the rate of a resting heartbeat. There's been a lot of research that's gone into just how to produce these tones to the patient. But it actually helps to blend in with the ringing to make the ringing a less noticeable thing.
So what are you trying to do? You're trying to tell your brain to stop listening to this?
You're trying to assimilate the ring into just normal sounds. And I always use the example of your refrigerator. If you go in your kitchen, you don't really notice the refrigerator running because you're so used to it. But yet, if you get a new refrigerator, that's when you really notice it because it's a different sound. So we're trying to make the ringing much like your refrigerator. It's just there, but you're just not paying attention to it. It doesn't really matter.
Now, is this covered under insurance? What does the patient have to do? How much does it cost?
Yeah, that's a good question because it really depends on whether your insurance covers hearing instruments, hearing aids, and unfortunately, a lot do not. So the nice thing is Widex, which is the company that has produced this instrument, they have brought that instrument out at many levels of pricing. It used to be only in their high-end aid, but within the last couple months, it has dropped into all levels of hearing aids, which gives you a lot of choices.
All right, so if you're hearing this thing, if it's bothering your life, obviously you probably need to go and see a doctor.
Yes, your first step is to get your hearing evaluated, to find out that, and also an ear, nose, and throat physician. Be sure there's nothing medically creating this, but in most instances, there isn't any kind of pill or cure for this. And that really is very distressful for patients also, because then they're told, there's nothing we can do for this, go live with it. Are you kidding? I'm going to ring like this the rest of my life? And that's where I think people need to know they should go to an audiologist and start looking at some of these approaches to helping.
All right, Dr. Christine Raffo, thank you so much for your time this morning.
Yes, thank you for having me.
Very good information, appreciate it.
Thank you.
All right, thank you. When we come back, chicken soup in our Let's Eat kitchen, but nothing like Mom used to make. Stay with us, we'll be right back.